Hi, everyone. Welcome to the Crisis Residential Association webinar, Anti-Racism in Mental Health Treatment, featuring Ms. Dawn Pullin. This webinar will be recorded and we plan to post this on the Crisis Residential website. Everyone will be muted and we ask that you post questions to the question box on the right side of your screen. Click on the red arrow in the upper right side to open the question box. We encourage you to engage in this discussion. This webinar will be interactive. We'll be asking you questions to answer during the webinar and ask that you complete the survey at the end of the presentation. Slides and the recording of the webinar will be available to the members of the Crisis Residential Association. I encourage you to join the Crisis Residential Association if you haven't yet. The Crisis Residential Association is a gathering of individuals and institutions who are involved in crisis care. We find that since we are the only crisis providers in our regions, we can feel isolated from others in different parts of the country who are doing the same kind of work we do. We decided we wanted to create an ongoing association and advocate for comprehensive, dignified, and financially sustainable services for those experiencing a mental health crisis. Membership for the Crisis Residential Association is now open. Membership benefits include discount conference registration, free webinars on relevant topics, networking opportunities with peers, and access to a national listserv of over 200 plus providers. There are discounted rates for full-time students and people with lived experience. Our next live conference will be October 12th through 14th in Louisville, Kentucky, and registration is now open. I am Carrie Wyrick, Director of Community and Crisis Residential Services, NetCare Access in Columbus, Ohio. NetCare has been operating an adult crisis stabilization unit, crisis residential home, and providing crisis services for Franklin County, Ohio, since 1996. And now I'd like to introduce Ms. Dawn Pullin from the Northeast Ohio Black Health Coalition. I really think you will enjoy her presentation. Dawn Pullin is a phenomenal woman who empowers others to move from just being to phenomenal. Her passion for advocating and assisting those who are struggling with substance abuse, trauma, and mental health issues has been her lifelong mission. In addition to her associate's and bachelor's degrees in nursing from Norfolk State University, she has a master's of arts in education from Malone College in Canton, Ohio. Dawn is a licensed professional counselor and a chemical dependency counselor assistant. Currently, Dawn is the Behavioral Health and Addictions Director at the Northeast Ohio Black Health Coalition. She is also CEO of Restoration Community Services, LLC, a community-based behavioral health and substance abuse treatment center, and Phenomenal Women DP Ministries, a nonprofit organization. Dawn is an example of the positive outcomes that can manifest after your life has been affected by substance abuse, trauma, and mental illness. As a survivor, she has overcome many obstacles and is still making a phenomenal impact on men, women, children, families, and the community. So now what we would like to do is, and here's Dawn. Here she is. Hey. Now what we'd really like to do is start with some polls. So we're going to ask all of our attendees to this conference some questions, and we'd like you to answer them directly on the screen. So Dawn, I will pull up the first poll.
Okay.
And this poll is, have you ever experienced racism personally? Okay, and we've got, go ahead, vote. This is an anonymous poll. And we've got about, it's a very even divide, Dawn. We've got about 50-50. So
okay.
I think it's a very, very interesting poll. Have you ever experienced racism personally? And we've got about 75% have voted. So now I will close out the poll and I will share that.
Wow, this is interesting. I'm excited.
Okay. All right. So we will go to our next poll, which will be, have you ever witnessed racism in your workplace? Go ahead and vote on this. And this is fascinating. A lot of folks are answering yes to this poll. So this is very interesting. Go ahead and vote. Have you ever witnessed racism in your workplace? So, wow, we're at 80% voted and 80% yes. So I'm going to close this poll and share the results. Now, our last poll will be, have you ever heard a client tell you about racism that they experienced personally? And go ahead and vote. We've got a lot of folks answering yes to this. Wow. 92% have answered yes. So I will share the results.
Wow.
So it seems like we've got a mix of folks who have experienced racism personally, but just about everyone has witnessed it or heard a client talk about it. So what I'm going to do now, Dawn, is I'm going to make you the presenter.
Okay.
Okay, so Dawn, take it away.
Hello, everybody. I am so excited to be here today. I am grateful for the opportunity to be in front of my colleagues and to be here and to be invited. I want us to have a really rich conversation and discussion. This is just not about me talking, but I want you all to put in the chat your questions. I want to be able to have those questions, talk about those questions. So as we go through the presentation, as we go through it together, I want you to feel that you are welcome to definitely be a part of the conversation. So with all that being said, I just want to say thank you for answering those poll questions. We will go through this and dive through this and come out with hopefully some great solutions and insight as to what we all can do to deal with racism in our workplace when we experience racism and when others are going through and talking about it, especially with mental health. It's definitely taboo and has a stigma to it. So that in itself is something that we deal with in battle every day. So with that being said, I just want to start off with a little story so that you guys can get to know me as a person a little bit more. One is I lived in California when I was in the kindergarten, and we moved there from Ohio. And when we moved there, we lived in Fairfield, California. My dad was in the Air Force, and my mom was a stay-at-home mom most of the time until she got a little part-time job or whatever. To just take up some time. And I went to school, and I went to kindergarten, and I was so excited about going to school there. I was excited about being in a new place and meeting new friends. And I went to school every day, and I came home crying almost 2 to 3 times a week. And I would tell my mom, I don't like it there. They don't like me. I don't know why they don't like me. This is just not fair. And my mom was like, what's going on that you cry every time? And I just couldn't explain it to her. And I was just like, I just kept saying, they don't like me. They don't like me. And so finally, my mom went to school with me one day, and we would play Farmer in the Dell. And when we would play Farmer in the Dell, I would always have to be the cat, the dog, some type of animal, or the last person picked in the class for whatever. And I thought I should be able to be the farmer or the wife or the farm hand or something like that, not an animal. So I would go home and I would cry to my mom and I'd be like, I don't like it here. And she would be like, well, finally she came to school and, she was like, I said, the teacher, we played Farmer in the Dale. And it didn't matter that my mom was in the classroom with me. The same thing happened in her presence. And so, I was like, well, mom, see, I told you they don't like me. They really don't like me. And I don't know why they don't like me because I really want to make friends because we're in kindergarten, right? And at the time, I just knew that I wanted to make friends and that I wasn't, feeling comfortable or accepted in my kindergarten classroom. And my mom came and she saw what was going on and she had a conversation with the teacher. And the teacher, the next time we played Farm in the Dell, she made me the wife. And so I was no longer an animal, but I was allowed to be a human being in that situation. Well, what I left out and what I didn't tell you is that I was the only African American child in a whole Hispanic classroom. And I did not speak Spanish. I spoke English, and a lot of the population in our community where we lived was Hispanic. And so those children knew each other, they were comfortable with each other. And so I was the outside looking in. But I remember that even as a kid and as I grew up, that was my first experience what I felt was, racially motivated because my culture was different or my skin looked different or I was different. And so in the kindergarten, that was my experience. And my mom explained to me that the kids didn't know any better, that they didn't mean any harm, but that they knew each other and they were comfortable with that. And so after the teacher allowed me to be the wife in the farmer and the dad, I was excited about that because that meant I would be accepted and that the kids would begin to talk to me maybe and play with me. And that's all I wanted was to have friends in kindergarten. And what happened was one young lady decided that the next time we played Farm in the Dell, she called me and I was not an animal. I was something different. And they began to warm up to me and I made friends, which was great. And I wasn't on the outside looking in, but I was beginning to be accepted in that atmosphere and in the school setting. So I didn't go home every day crying. Or feeling less than. My teacher was very supportive, and the classmates that I had, I began friends with them. And after that, I was at their house all the time and eating, and I was learning Spanish and all kind of wonderful things. But those are things that we experience in our childhood and as people grow up that can make or break their ideas about what racism looks like, how it feels. And even when it's not motivated. A 5-year-old doesn't know about race. They just know that we're different. A 5-year-old doesn't, they just know we look different. But I don't believe it was blatant racism. But I believe that it was a cultural difference. And part of that cultural difference can lead to people being left out and people being pushed to the side or not accepted as part of the culture of that school or in that classroom or in the community based on some differences that they may have. So I say all that to say at 5 years old in the kindergarten, that was my first experience. And I lived through it and I made it through and it wasn't as bad. But there are things that people go through early in life that definitely transforms their minds and the way they think and see the world, the community, and the people around them that can definitely foster mistrust um, and an unwillingness to bend or to change or whatever that is. So I said all that to give you a point of reference. And now I'm going to do my slide presentation and we can have a conversation. So thank you all for joining. I'm excited to be here and I'm excited to hear what you all have to say. Okay, I'm going to share my screen here. Okay, I need to go here. Here we go. Sorry guys, I pushed the button, but it wouldn't go. There we go. So, as you all know, my name is Dawn Pullin, and I'm from the Northeast Ohio Black Health Coalition.
Hey, Dawn,
And
you need to share your screen.
I didn't hear it. I'm sorry. Thought I did. Technology is not my friend. I just want everybody to know that. Okay. Tell me if you can see it. I'm gonna.
We can see, oh, we just lost it. We could see your slides a minute ago. There we go.
There
If
we
you
go.
want to
Can
put
you
it
see
on
it now?
display.
Okay. Yes. There we go. All right. I am from the Northeast Ohio Black Health Coalition, where we educate, advocate, and empower our community to grow and learn and to thrive and to advocate for African Americans. The Northeast Ohio Black Health Coalition is a social justice organization created. Why does that keep happening?
You're fine.
Okay. Okay. Created to, I have this little box in my way. It's my problem. Okay. To impact racism on African American disparities, including inequities, historical trauma, food insecurities, research, behavioral health, and addiction, health promotion by working to empower, educate, and advocate for health equity in underserved communities. And this is me. I know I look fabulous in this picture. And my goal as a behavioral health professional is in addictions worker is to increase awareness of I'm sorry, I got this little box and it won't move. Okay. Promoting behavioral change through programming and education. So one of the things that I work hard on at as far as my behavior, what I do is to make sure that people understand the importance that trauma, addiction, and domestic violence affects our behavioral health and mental health, and working on programs that will educate and advocate for members who are experiencing mental health and addiction issues. Why do we need to do this? Why am I so excited about this? Because the world needs to know how important it is that we embrace those people or persons who have mental health disorders, and how do we do that in an equitable and fair way? The Northeast Ohio Black Health Coalition effectively engaging the American community dealing with Black trauma, ethics of racism and health disparities. In order for us to really understand racism and the effects that it has on mental health, and especially for African Americans and other people of color, is that we have to understand in the framework in which a person of color comes from and the trauma that they've experienced. So if we don't understand their past, we can definitely not understand their present or their future. Because people say, well, why do we need to know that? Because it gives you a point of reference and it gives you an understanding as to why people of cultures and colors respond or react or do not engage in certain activities. So topics of best practice to engage the community on all levels while understanding what we do and why we do what we do in the social realm. So across the world, I want everybody to know the importance of dealing with racism and when it comes to mental health and how we can do it better. I got it. Okay. Racism, race and racism. Race, how to we group humans based on shared physical traits. So that was one of the things that I believe happened when I was in the kindergarten, based on shared physical traits. I did not look like or speak the same language as the persons or the young people that I went to school with. And so based on my race, I was excluded from activities or was given lesser roles in activities than my counterparts. And so when I think about that, I didn't know what race was at 5, but I definitely, that was something that stuck with me for pretty much the rest of my life. But I was able to process it because my mother helped me through that process, and the teacher did as well. Racism is the belief that race is a fundamental determinant of human traits and capabilities, and that racial differences produce an inherent superior of race. So, you know, for our work, we have to understand that some people don't believe that people of color or people from other nationalities or ethnic groups are smart, are intelligent, are able to comprehend or understand or make decisions. And that is not all, that's not true, but some people believe that. And so they make decisions based on a false perception of what they believe or have encountered with a certain group of people. African American experience in the US. So this is part of the history that I think everyone should know about. American slavery, 1700s to the 1865. Black people in America were slaves. They were brought here on slave ships. They were brought here to do, first of all, rice was the first crops that they were brought here to do, and cotton was the second crop. I didn't know that until I saw a documentary a couple months ago, and it was given the history. And African Americans in Africa were rice growers, and they used to sell rice from Africa all over the country with those people who, all over the globe, with people who would come there to the ports on the Gulf Coast, and they would have trades. And so in 1865, segregation began. So we went from slavery to segregation, and we're there for 89 years and still have segregation till this day. And so when we talk about how can we as mental health professionals really grasp the concept of what African American and people of color have dealt with over the last 400 years, this is where we start. We start with what is the history. And I know people say, well, that was over 400 years ago, but there's still generational things that are taught in African Americans and in other cultures that still perpetuate from slavery. You have to remember that 400 years of 246 years of something still has an impact 200 and something years later, and that is true. Historical trauma is something that has gone on in this country from the day that African Americans were put on slave ships and brought to America. That was trauma. They were brought here not on their own free will. They were brought under duress. They were put in small quarters. They were left there, and some died. And so people watched their family, friends, and others die on slave ships. And they were brought here and told, oh, well, figure it out and keep it moving. And there's no time to grieve. There's no time to understand. They didn't have familiar language. They were told they couldn't talk their own language, that they had to change their names. So everything was stripped from them at that time. And then they were also used in medical experiments. Dr. Sims, he experimented on African American women. He used them to do gynecological experiments without their permission. He did a lot of things without allowing them to have medication, but he's known as one of the best doctors in gynecology, but it was done on people who were human beings who were not given options if they wanted those things done to them. We all know about the Tuskegee experiment. Henrietta Lacks just had a centennial year, her 100th year. She was an African-American woman who had a cancer tumor, and those cells were harvested and used for research for over the last 100 years. And a lot of the research that has been done and still being done in our country is due to her cells. And so some of the things, cancer, and some of the things that they've been able to cure has been because Henrietta Lacks cells were harvested, and some of her families as well. And they were not compensated, and they were not told that this was going to be done, but it just happened. And so that is some of the things that African American people have experienced. Two periods that African American health status improved was in 1865 through 1872, post-Civil War Reconstruction, linked to Freedmen's Bureau legislation and establishment of Black medical schools, hospitals, and clinics throughout the South. So there was a time when African Americans were thriving well and doing well in their health and their mental health is during those times. It saved us from extinction, I'm sorry. In 1965 to 1975, we had the Civil Rights Movement, and everybody knows about civil rights. They know about the laws and discrimination. We had Medicaid and Medicare, hospital desegregation was enacted, and community and neighborhood health centers were set up. In 1975, post-civil rights movement gains were halted. So from 1965 to 75, we were doing well and things were thriving and people were getting their needs met. And then in 1975, the civil rights movement gains were halted. So since 1980, big declines in the health status of African Americans, busing, war on drugs, black flight, closure of mental health facilities, opening of prisons. These have all had an impact on trauma and the mental health status of African American people. In 2006, we had the Affordable Care Act, Obamacare as it's called, and Black Lives Matter. Then Black life expectancy dropped from 75 years to 72 years, more than 2.7 years, lowest since 2001. And it has dropped since I've done these statistics. So the last time I looked, I think we were up to 3 to 4 years life expectancy, less than our counterparts. COVID-19 has had a detrimental impact on Black community. 2.9 times the rate of whites to be hospitalized, 1.9 more likely to die than white Americans, anti-racism in the hospital settings, and menthol restrictions are some of the reasons. So one of the things about the anti-racism in a hospital setting, it's important that people understand that when people are not physically not taking care of their mental health needs are not taken care of either. And they believe that when they go to the hospital and they talk about their mental health with their physicians and people in the hospital, that they are not given the same treatment or understood. They're told, oh, get over it, oh, you can handle it, or it's been said that African Americans can handle more pain than other people and other subsets, which is not true at all. So Houston, we have a major problem. So we understand that we had some great things happen. Released in February 29, 1968, the civil disorders. And then Reverend Dr. Martin Luther King Jr. pronounced the report a physician's warning approaching death with the prescription for life. And then poor health results in high mortality rates, higher incidence of disease, lower availability and utilization of medical services. Infant mortality rates are up 58% higher than our white counterparts. Ohio needs to determine what can be done to improve the behavioral health and well-being of Ohioans from diverse backgrounds with the ultimate goal of achieving health equity. And that's what we're here to talk about today. But I had to give you the history so that you could see the framework in which I'm working from and understand why this is so important to me and a lot of other people in our community. Minority communities often carry a higher disease burden than other groups. They're more sickly. They have less opportunities to get great care. And so this is part of the reason why they go without care or mediocre care. Of the 4.5% of all Ohioans who reported a disabling mental health condition in 2005. So out of that, that was in 2015, I'm sorry, and they did an assessment. Prior to the pandemic, we know that 1 in 10 adults reported symptoms of anxiety and or depressive disorders. Nearly 1 in 5 US adults, 47 million, reported having any mental illness. In 2018, over 48,000 Americans died by suicide. And suicide rates right now in the African American community for males and females has increased since the pandemic. And I'm going to give you a story right here. I have a young lady who I knew for probably 15, no, my son's 20, probably about 20 years. We were both social workers at the same time, African American woman who came from foster care, who went to college, graduated, got a degree, and was working in social work for years. Recently in our community committed suicide at the age of 40, and she passed away. And so when I tell you that mental health in our community is detrimental, it's rising and it's getting dangerous because we're seeing more and more young people and more adults having fatal situations. In 2017 and 2018, nearly 11 million adults reported having serious thoughts of suicide in the past year. Deaths due to drug overdose were 4 times higher in 2018 than in 1999, driven by the opioid crisis. African Americans are plagued with persistent race-based disparities that have existed for centuries, and this has impacted their health compared to their white counterparts and the population as a whole. So why do we need to do the work to help and to understand what we need to do to help African Americans and people of other cultures to embrace mental health and to work on their health overall? Racism in Medicine and Health Parity for African Americans, the Slave Health Deficit National Medical Association of 2002. Racism in medicine has operated in the institutional, intellectual, policy, and personal levels, deeply ingrained in the fabric of the U.S. So a lot of times people don't even understand or get why, what's really going on, because it's so normal. We've just been able to, it's just how we always done business and it's how we always do things. But at the same time, doesn't mean it's right. It just means this is how we've done it. It's our pattern of behavior, but it doesn't mean that it's helpful or it's beneficial to all constituents because this is how we've always done it. To eliminate persistent race-based health disparities in the U.S., we must implement dramatic changes in policies that hide the structural functioning and financing of healthcare systems, and must direct efforts to produce a system and workforce that are culturally competent in dealing with African Americans. And it's just not about being culturally competent, and we're going to talk about that in a little while. Where does health begin? Health begins in utero. African Americans have the highest infant mortality rate, especially in the state of Ohio. We have babies that die on a daily basis. We have mothers at a higher rate who deal with death or complications during pregnancy as well. Pervasive discrimination disproportionately impacts health, education, housing, and employment. So what we know is that if we are impacting education, housing, and employment, our health is declined because our health goes last. Because we're worried about how we're going to eat, how we're going to live, and how we're going to be educated in order not to live in poverty. So, we have to think about those things when we interact and engage with our fellow constituents and those who are working with minorities, that we have some framework. I'm gonna take a pause right here. Do we have any questions? I know I'm giving you guys a lot of information.
I don't think so. It's fascinating, though. It's fascinating.
What must be done? This is where we all get to work together to make something happen for our communities and for our clients. To eliminate persistent disparities in the U.S. must implement dramatic changes in all policies. All policies should include a reparations lens, not your policies, but across the United States. All policies and health policies direct efforts to produce a system and workforce that are culturally proficient in dealing with African Americans. So what I'm going to say is this: policies that are made in your workplace, policies that are made in the government, all affect a person's health and ability to live healthy and have a healthy life. And so what I know is that if your culture at your agency or your policies at your agency are not culturally proficient, then that is where you can, as an employee, as a advocate for your clients, may be able to help with changing the culture and to embrace members of all communities, and African American people and other people of cultures and other people of different races. Because what we fail to realize is if we don't have policies in place that embrace everyone, then we're doing all of us injustice. And so even you as an employee there should be policies in your workplace that are culturally proficient. And what does culturally proficient mean? And so I'm going to give that definition to you now. We'll talk about it a little later as well. Cultural competency means that we all are aware that there's a problem. That doesn't mean that and cultural proficiency means that I'm not only aware that there's a problem, but I'm willing to do something to create a better culture and to look at myself and say, what can I do to do things better? And to be an advocate for change when I know that there's things that are going on that are not culturally proficient, that are unhealthy, and that cause harm to other people. So culturally competent, I'm glad that everybody's taking that class, and you take it every year, and you're culturally competent because you're aware that there is a problem across cultures. But cultural proficiency takes you to the next level, meaning that I'm not only aware, but I also understand the need to change it and to do some things to help others and advocate for others for those changes that I see in my community, on my job, that are not fair and reasonable towards people of other cultures. So we know that there's structural racism. If you don't know, you learned today that there is structural racism in every aspect of our government. Every aspect of our country has some type of structural racism because all of these things are ran by policy. And we understand that policy is written and policy puts things in place. And once those things in place, they become laws. And then those laws affect those people in our communities. And it also tells us how to navigate in our systems. And so when we have structural racism across all of these systems, it definitely affects our ability to be healthy, mentally, emotionally, and spiritually grounded. And it causes a lot of other issues as well. So we know that prevalence of mental illness and substance use disorder during the pandemic has increased. I just wanted to give you all some basic information because I am dealing with COVID-19 survivors. I do a COVID-19 support group with long haulers, survivors, and those who have suffered loss. And so what I found is that the African American community has suffered great loss in our long haulers due to underlying conditions, and COVID-19 has definitely caused a great awakening for our country and the world around racism in this country and how people are treated. So during COVID-19, concerns about mental health and substance has grown. We all know that increase in current suicide ideation and attempts has been. In January 2021, 41% of adults reported symptoms of anxiety and or depressive disorder, and share that has been largely stable since 2020. In a survey from June 2020, 13% of adults reported new or increased substance use due to coronavirus-related stress, and 11% of adults reported thoughts of suicide in the past 30 days. Suicide rates have long been on the rise and may have worsened during the pandemic, which we discussed that earlier. Earlier in 2020, data showed that drug overdose deaths were particularly pronounced in March and May of 2020. So we know that this pandemic has caused us mental health professionals to be on high alert, and our clients are increasingly having more and more issues and trauma, especially around substance use and anxiety and depression. And then we have more people who are 18% of individuals who had never had a mental health disorder have been diagnosed with either a mental health disorder, anxiety, or a mood disorder since the pandemic has started. And this is from Kaiser Family Foundation in 2021. So according to Kaiser, the pandemic, anxiety, depression, sleep disruptions, thoughts of suicide, all of these things have increased. And as mental health professionals, we have been on the front lines dealing with our clients and those people who have suffered these increased in mental health symptoms, and they are not getting the treatment that they need due to the pandemic and being quarantined and all that other stuff. But thank goodness we were able to implement the telehealth. So that was very beneficial, but still hard for for mental health patients. 56% as of December 2020, compared to our older adults, 18 to 24, have reported symptoms of anxiety and depression. Let me go back. Since this pandemic started, we have the people between the ages of 18 and 24, 56% have stated that they have some symptoms of anxiety and depression. So when we talk about all of this and how it's working, we have to think about the share of adults reporting symptoms of anxiety. We have other non-Hispanics at 48.9%, non-Hispanic Blacks at 48%, Hispanics or Latinos at 46.3%, all adults at 42.4%. So at our white counterparts are at 40.9%, and non-Hispanic Asians are at 33.1%. So this is what it looks like for our African American and non-Hispanics and Hispanics and Latinos in this country when it comes to dealing with symptoms of anxiety and depression and COVID-19 as far as race and ethnicity. So cultural proficiency, Black Lives Matter, all lives matter, blue lives matter. Black Lives Matter doesn't mean that other lives don't. It's simply asking that the Black community also achieves the justice they deserve. And so when we talk about Black Lives Matter, I know people are like, that gets on my nerves, it drives me crazy. But when you are a member of the African American community and you understand that people are dying at a greater level, and I have a friend that I work with who lost 39 of her high school friends from COVID-19 in a year. It touches our lives at a greater level and a more intense level than our counterparts because we're dying faster, and we're dying because we don't have the services and things that we need in order to be able to flourish in such a pandemic. Why cultural competency refers to ability to interact effectively with people of different cultures and social economic backgrounds. And that's great. Then you have cultural insensitivity, also sometimes referred to as cross-cultural sensitivity or simply cultural awareness, is knowledge awareness. Cultural proficiency, as I said before, is the knowledge, skills, and attitudes and beliefs that enable people to work and go do the work and proficiently and support people across lines. So the case of health equity is achieved when every person has the opportunity to obtain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Affecting change and reform outcomes. So this is what we all can do to help and to deal with. I'm going to bring it in back to mental health in a minute, but I got to bring this out. Social justice interventions to address the social determinants of health should not be designed using a top-down approach. So if your agency is dealing with social determinants of health, dealing with mental health, dealing with the constituents of mental health. Those decisions shouldn't just be made by administrators and people who run the agency or the company. We should be having our constituents at the table in the meetings and their voice be heard as to what their needs are and how their needs can be addressed better by our agencies and our organizations. And that is where the reform comes from, and that is where the changes come in, and that is where mental health meets the client where they are. That is where we as counselors and crisis intervention people understand that we need to have conversations with the persons or people that are our constituents who are receiving our services, and they need to be at the table so that we can be culturally proficient and culturally competent in knowing what they describe their needs as and not what we believe their needs are. Because when we say what we feel they need, we are exercising our privilege and not exercising inclusivity. So there's the difference. Make sure that the workforce is culturally competent when dealing with African Americans and other cultures. We need to make sure that we have African American counselors, African American mental health, African American doctors and nurses in our facilities, and other Asian and other groups as well. Because if those are our constituents, we need to make sure that we're able to meet their needs and be culturally proficient in dealing with them and have people that look like them in the room and in the office and at the crisis mobilization unit and all of those things. The system that has evolved over time results in the outcomes we experience. What we know is that the system that we have been living under for the last 400 years or more is not working. It's broke. And we need to figure out how we're going to fix it together collectively and take care of those people who are our constituents and who we deal with on a daily basis, who feel the pinch and the stress of the racism and the structural racism and deal with it every single day. So when we talk about those things, what this means, we have to change the way we engage the African American community. Relationships take time. We need to trust its development over time. You can't change who you are, but you can understand who your audience is. Social workers and other health providers as mental health professionals have long recognized the need to provide culturally sensitive programming to enhance awareness of ethnic groups. So this is not something that we don't know, and we've been knowing. We've known it for a long time, but we haven't been able to implement those things on a great level that it has a greater impact. So what white Americans have never fully understood, but what the Negro can never forget, is that white society is deeply implicated in the ghetto. In other words, white institutions created it, white institutions maintain it, and white society condones it. And that is from the Kerner Commission's report. But if you want to believe and do some changing and help our clients with mental illness, this is how we can do it. Believe that someone or something is reliable, good, honest, and effective. Listening. We need to listen to our constituents. We need to listen, not to respond, but listen so they can be heard. Community and professional wanted to voice their concerns. Stand up for your community. Stand up for your clients. Advocate for them. Community leaders, respect it. We need to be able to find respectable community leaders. We need to have members on our staff and in our teams that are respected in the community that we serve and that can make connections and bridges for us so that we can do the work at a greater level and be more proficient in what we're doing. Racism will disappear when it's no longer profitable and no longer psychologically useful. When that happens, it will be gone. Toni Morrison speaking to the NPR Michael Martin in 2008 interview about her book. So in conclusion, I think I should be almost done. Seek out ways to get involved with the Northeast Ohio Black Coalition or other community level partnerships. Seek ways to advocate for funding for African American organizations. Create ways to improve the cultural proficiency and diversity of the health related workforce. Your workforce, counselors, training, all of those things that we can put in place to help us be culturally proficient. No more for us without us. Bring your constituents to the table. Allow them to voice their concerns and their opinion. And it doesn't mean send out a survey every year and let that be the reason, because no, that's not going to work. We've been doing that and we have not fixed the problem, and we have not made major strides on how we can fix it. But if we are really serious about being culturally proficient and working with mental health clients, these are the things that we have to do. Understand their history, understand their past, understand their hesitancy to engage because of their experiences, and then be open to deal with our own stuff, because we have to understand that they need us as much as we need them. But we also have to make it a place where they are comfortable and they feel that they can come and speak those things to you, and that it will be open and culturally proficient. You will be culturally proficient enough to deal with it. Because if you and your biases are in the way of how you treat your clients based on race, ethnicity, etc., then this is an opportunity for you to check in with yourself and say, what can I do, or what biases do I have that I can work on, that I can better engage African Americans? And how many times have you listened to things on TV and the radio that have said negative things about cultures or people that have stuck with you, that in the back of your mind, unconsciously or consciously, that you may have, that you think of when you're engaging African American people or people of other cultures? Because what I can tell you is there's lots of things. And what I can tell you is it's not always true and it's not always applicable to every person. And just because I'm a member of a culture or a race or a group of people doesn't mean that we all can be treated the same and that we all have the same needs. But what we do deserve is to be treated equitably, fairly, and to be treated as a human being on every level. And so that's the work when it comes to mental health and when it comes to clients that you are doing. And that's the work you should continue to do at the highest level of proficiency as you can. That means that you're learning and growing. That means that you are definitely sharing your growth with your work, other workers, and people in your groups, that they can have a better understanding and see things differently and view people differently, because we all have, family, friends that don't always agree. But one thing we do know is that racism has to cease in this country in order for us to do our jobs better, and we all have to do our part. And I'm not saying racism is the only thing that needs to change. We have to change our mindsets. We have to change how we look and how we think about other people. And we have to learn from what we know and retrain our minds and retrain ourselves to look at people as individuals and not as a race or a group, but as a person, a whole person that's coming to you for services, who deserves to be treated fairly and equitable. And if we treat people the way we would like to be treated, I'll tell you that it would not even be a need for half the things that we are doing right now. We wouldn't have to be culturally proficient, because we would know that everyone deserves the same treatment, and that we need to just move forward in doing just what we call to do, help serve those people to get their mental health together, and to make sure that the services we provide are good for them, and that we're doing the best we can be at being culturally proficient. I'd like to thank you all for joining me, and I hope that something I said or didn't say, or that you learned something today. So thank you all.
Dawn, I've got a question here for you.
Okay.
You talked about policies that were kind of had racism built into them. Could you talk some more about, give me an example of a policy for an agency that might have racism built into it, and how could we spot that?
Hold on, I'm trying to. Can you guys see me?
Yes, we can see you.
Okay. I can't see you guys, but okay. I hate when I can't see. Okay, so when you talk about, let's say I work at I'll give you an example of what happened to me. I work for the state a long time ago, a different state, not Ohio. And when I worked for them, they had this policy that if you were 15 minutes late, that you couldn't have your appointment and we had to reschedule you, and it didn't matter what your excuse was, it didn't matter any of those things. And so, as an advocate for my clients, I felt that to be unfair. Like, how is this fair when she took 2 buses to get here and the bus was late, but she showed up? And I'm not saying that an hour late is okay, but what I'm saying is we have to learn to have some flexibility in the things that we do and understand that every person doesn't have a car, and if they're using public transportation, that there may be some times when they're late. And I understand holding people accountable, but I also understand making it very stressful and difficult for them to be able to engage in the process of healing and getting services. And so that is one of the things that I advocated for. Like, if they're 15 minutes late and they show up 20 minutes late, I might not be able to see them for a whole hour, but I'm going to give them the time that's left. And that way, at least they're not frustrated with the rules that we all have in place that is causing them more stress and trauma than if I would just see the client for the 30 minutes that we have left and not make them reschedule every single time. Like, if it's consistently that way, I understand, but every once in a while a person's late, that's just not right. And so, you know, we need to be cognizant of how we're treating the people that we serve, and then also be cognizant of what their needs are, you know. And how we do that is policy. Also, let's say in the hospital setting, you know, we have a policy committee at the Northeast Ohio Black Health Coalition, and we're working on an anti-racism in the hospital setting. And we send out surveys to ask people, when you engage in the hospital setting, have you ever been discriminated against, or have you felt that they were not fair to you? And you know, it's been not just Black people, these are white and Black, Hispanic, all types of people from all over the country, all over the world. And most of the responses were yes. And so, how do we make it comfortable for people to come and get services that they truly need, and not feel alienated or not heard or treated differently, or, you know, because they look a certain way? And so, those policies, you know, I mean, just little things. I can give you some more stuff, but it would take too long. And I don't want to go over time. So sorry.
I appreciate that. I appreciate that. I also think in terms of promotion and job development, in
Yes.
terms of working with our employees and having a job development pathway for promotion for every position, not just positions that come to people who are highly educated.
And that's true too, because I had that experience. I had more education. I've had more education, more experience, and had to train the person who was going to supervise me. How does that work? Yeah. I have a friend who's going through that now, and there's another young lady. We just did a disparities conference on Friday and Saturday of last week, and it was a young lady on it. She wrote a book, and she talked about how she worked at a college, and you know, they would mistreat her and say different negative things about her hair, and you know, just different things, and she was passed up on promotions and different things of that nature and she would have to train the people who would be her supervisor. So when you see those types of things going on, those are the things that even in the workplace that we can support. You know, don't turn a blind eye to it. I know you don't want to lose your job, but at some, you know, we still can't stand around and tolerate people being mistreated.
Dawn, I thank you so much for this this presentation. It's really been very interesting and fascinating. And I just encourage folks to join the Crisis Residential Association so you can get more of these kind of webinars and contacts. And please complete the survey after the completion of the webinar. So thank you, folks, and we hope to see you at the conference in Louisville. Thank you, everyone. Thank you, Dawn.
You're welcome.